Hello, welcome to the SPF PFS Initiative's on-demand learning event titled Introduction to the Community Logic Model. This learning event is presented by Ohio's SPF PFS Evaluation Team. My name is Holly Raffel and I will be facilitating today's learning event. The learning objectives for today's event are for Ohio's SPF PFS project directors to be able to 1. Summarize the following components of a theory of change: problem statement, intervening variable, strategy, short-term outcome, and long-term outcome. 2. Explain how data is used to develop the components of a community logic model, also known as a theory of change, and how the components connect to each other in a logic chain. And finally, summarize how to select evidence-based prevention strategies to implement based upon a community-driven logic model or theory of change. Before we begin, I think it's important to review SAMHSA's strategic prevention framework. This time, we will look at the SPF through the specific lens of outcomes-based planning. The SPF is based on a few theoretical models. The first model is the social ecological model. The social ecological model illustrates how human behavior is impacted not only by the individual's free will and choice, but also by the individual's interactions with the world around him or her. In the ecological model, health status and behavior are the outcomes of interest, and these are viewed as being determined by the following elements. First, public policy. Local, state, national, and global laws and policies shape our nation's health. Next, community. Relationships among organizations, institutions, and informational networks within defined boundaries. This includes the location in the community, the built environment, neighborhood associations, community leaders, housings, businesses like bars, fast food restaurants, farmers markets, commuting, parking, transportation, walkability, and parks. Next, we have institutional or organizational factors. Social institutions within organizational characteristics and formal and informal rules and regulations for operations. So these include things like school climate, financial policies, competitiveness, lighting, unclean environments, distance, noise, availability of common space, as well as things like air quality and safety. Getting closer to that individual are interpersonal processes and primary groups. These are formal and informal social networks and social support systems, including family, work group, and friendship networks. Finally, you have that individual, and those are intrapersonal factors, and those are characteristics of the individual, such as knowledge, attitudes, behavior, self-concept, skills, and developmental history. The social ecological model lets us know that there are multiple points of intervention on behavior that can be helpful to promote the health of not only the individual, but also the health of the community. The second model that influences the SPF is the epidemiological triangle. This is a model that scientists have developed for studying health problems. It helps us understand infectious diseases and how they spread. The triangle has three corners: the agent, or microbe that causes disease, the what of the triangle, the host, or organism harboring the disease, the who of the triangle, and the environment, or those external factors that allow or cause disease transmission, the where of the triangle. Let's take a common example, chickenpox. The agent is the varicella virus. That is the cause of the disease, or the agent. The host is the humans. We harbor the varicella virus. It's important to note that different people may have different reactions to the same agent. For example, adults infected with the virus varicella are more likely than children to develop serious complications from chickenpox. Finally, the environment is the favorable surroundings and conditions external to the host that cause or allow the disease to be transmitted. It is transmitted from an infected person through cough or sneezes and from contact with fluid in the chickenpox blisters. Chickenpox is very contagious. Once a case has occurred in a group, such a classroom, it is very hard to prevent an outbreak unless people are immunized. In North America, chickenpox outbreaks are most common at the end of winter and at the start of spring, periods of moderate temperature when viruses thrive. The epidemiological triangle is integral to the SPIF because it introduces a systematic or data-driven approach to disease prevention, intervention, and treatment. To combat disease, we must get data from each part of the triangle and use that information to break the triangle and get the desired outcomes of either prevention, intervention, and treatment. Take a minute and think about how we break the triangle for chickenpox. What side of the triangle does immunization break? What side of the triangle does quarantine break? In the public health approach, we learn that if we want outcomes, we need data, and we can see that in the SPIF. We can also think of the agent-host environment relationship as it relates to substance abuse. In the application of the epidemiological triangle, one would consider the drug as the agent of exposure, the host as the individual taking the drug, and in the environment as the setting of exposure. Through the SPIF PFS needs assessment process, Ohio's coalition have been exploring the factors that influence underage drinking and the misuse and abuse of prescription drugs. Ohio's SPIF PFS communities have been doing epidemiological work. Epidemiological research provides information essential for defining the scope of the problem by identifying populations at risk. Epidemiological data on trends in illicit drug use and abuse over time help measure the effectiveness of the prevention, intervention, and treatment initiatives. Epidemiological research provides insights into drug initiation and use. Additionally, epidemiological research provides information on the nature and extent of the multiple consequences of drug abuse. Data on drug availability and demographics allow prevention and treatment programs to target the needs of those populations identified as at risk for increased alcohol and illicit drug use. The epidemiological work that Ohio SPIF PFS communities have engaged in during the needs assessment component of the SPIF will directly influence the strategies that they choose to implement. So the question is, why is the SPIF rooted in the socio-ecological model and the epidemiological triangle? Why is the SPIF rooted in public health? Well, the SPIF encourages us to broaden our thinking beyond the health of a single individual and look at the health of our community or of our population. By broadening our view, we are able to look at the outer layers of the socio-ecological model: policy, community, and organizational. This helps us work on creating nurturing environments to promote healthy lifestyle choices and prevent substance use. Using the SPIF also helps us, as professionals, address risk and protective factors. We need to support those things in our community which promote health and address those things in our community which cause harm. Taking population focus is a big job. That's why coalitions need members from many community sectors in order to work. Using the SPIF and examining those agent-host environment relationships and collecting data requires that we work together and share the responsibility for creating healthy communities. One agency simply can't do it alone. We need to collaborate. Finally, we need to be open to the notion that what works in one community may not work in the next. Each community must collect local data for decision-making purposes and identify that right solution at the right time that's culturally relevant for that particular community. So the question of the day is, how does this history lesson on the SPIF relate to strategic planning? Well, by definition, the SPIF is a public health model for intentional planning for achieving community-level change. It's a noun. If we unpack that definition more, we notice that at the core, the SPIF is a data-driven process which supports the identification, selection, and implementation of evidence-based strategies to address the health of a community. To create community-level change, the SPIF relies on three things. One, community development to engage into a strategic planning process that result in three, the implementation of evidence-based strategies to produce community-level change. As we have discussed previously, the needs assessment is what undergirds all successful strategic plans. We have to understand how the problem of practice is impacting your community if we want to be successful. This is why the SPIF relies on community-level data. Sometimes we see the SPIF used as a verb. Please take a look at these three statements. Using what you know about the SPF, please choose the statement that most accurately uses the SPF as a verb. 1. We spiffed our rally. 2. Today we're going to spiff our next service learning project. 3. We spiffed our plan for reducing the incidence of binge drinking for high school youth in our community. I'll give you a couple of seconds to think and make your choice. If you guessed choice number 3, you are correct. The first two statements are examples of activity-based planning. In order to do either event, you have to engage in thoughtful and intentional planning. However, the results of those two activities, on their own anyways, do not constitute outcomes-based planning because they do not list an outcome at the community level. The third example clearly explicates what the goal of the community level change is, reducing the incidence of binge drinking. Now, a rally and service learning can be part of a comprehensive plan to reduce binge drinking. However, planning the activity itself is not the SPF. The comprehensive planning process where those two particular strategies were selected may be constituted as the SPF. Here are the two conditions that must be met for the SPF to be used as a verb. The first, data-driven identification of a problem and clearly defined intended outcomes for a specific target or priority population. And 2, selection of evidence-based strategies and associated activities designed to lead to intended outcomes and change. So all of this background leads us to this big question: what is a logic model and why is it important? Some of you may have seen this classic example of a logic model before. This model is used by the University of Wisconsin Extension and is used by other nonprofits such as the United Way. It is designed to show how programs work and what outcomes they are designed to achieve. In Ohio's initiatives that use the SPF, we are very careful to make the distinction between the theory of change and the theory of action. The theory of change is the community logic model, and it tells us the why we are doing the strategies we selected. This is the heart of any strategic plan. It is the theory of change that gets us to outcomes. That is, if we know what our goal is and we carefully select our strategies, we will achieve our shorter-term goals, which will in turn help us achieve our longer-term goals. The theory of action, on the other hand, is all of that careful and intentional planning that results in strong execution of our strategies. Both the theory of change, or the community logic model, and the theory of action, or the community strategic plan, are essential in successful projects. You really can't have one without the other. It's why it's worth separating the constructs of the theory of change and the theory of action in our minds. It ensures that you are paying attention to both components of strategic planning. Simply stated, a theory of change provides an explication of our understanding of what strategies will lead to the outcomes we intend to pursue for populations that we are working with. Here's an example. A community's theory of change can be mapped as a logic chain or sequence of if-then statements. So if we do the strategies that we've chosen, then we can expect to get these shorter-term outcomes. If we get these shorter-term outcomes, then we expect that they will lead into longer-term outcomes. We will achieve our desired outcomes if and only if our logic chain is well executed and makes sense. Here's a full example of the logic model expressed as a logic chain. All of Ohio's SPF PFS communities have been working on a problem statement and identifying intervening variables. Our communities have also worked on doing focus groups or listening sessions and conducted community readiness assessments to determine what the local conditions are. By identifying the problem, figuring out what is causing the problem, the intervening variables, looking at the context or those local conditions, will help communities then select evidence-based strategies. The evidence-based strategies will be the right strategies at the right time that are culturally relevant and sustainable for that community. If we choose evidence-based strategies that are a good match, we should get our short-term outcomes. If we get those short-term outcomes, then we should get our long-term outcomes. The beauty of outcomes-based planning is that the evaluation is built right in. Let's take a look. The problem statement, which is based upon data, becomes your community's long-term outcomes. You can see those as bookends on our logic chain. So if we want to decrease prescription drug misuse among young people or reduce underage drinking, that then becomes our long-term outcome. But we know that we can't wave a magic wand and we can't fix either problem without knowing what's causing it. So we dig one step deeper. By digging one step deeper, we choose intervening variables that are based upon data. So those are things like conversations between parents and their children about substance use. Those are things like perception of harm or risk related to substance use, perception of peer approval related to substance use, perception of parental approval related to substance use. Those types of intervening variables become short-term outcomes. The trick with outcomes-based planning is we take a problem statement and we have to figure out why is that problem manifesting itself in our community. So that one step in is our intervening variables. Because if we know that we have high parental approval for underage drinking, for example, because people have done it before, kids have been drinking for the end of time, and we actually don't see a lot of disapproval, that could be leading to the outcome of underage drinking. So what we address is parental approval in a community and try to change that to parental disapproval, because we know that is an important factor that impacts youth and their drinking behaviors. The other thing we need to take account in, again, is those local conditions, including your community's readiness. Because selecting the right intervention, we need to look at the bigger picture. It's not good enough to say, here's my problem statement, here are these intervening variables that make sense. We have to look at our context. We don't necessarily measure the contextual variables. What we do is we use them as additional pieces of information that are going to impact our intervening variables, which would in turn impact our problem statement. In yellow, of course, are those evidence-based strategies that we are going to select. On the other end, the evidence-based strategies will pull the lever on the intervening variables, and if we're successful and we pick the right intervening variable in our community and it's data-driven, then we will be able to make a difference in our long-term outcome. So the question becomes, how does outcomes-based planning translate to the SPF? Take a minute and think about it. Where do all the pieces and parts of the outcome-based planning model fit with the SPF flower? We think they map on quite nicely. The whole process is a plan, so that takes care of planning, the purple component. The needs assessment component, the red petal of the flower, is covered through the data-driven discovery of our problem statement, intervening variables, and local conditions. We implement evidence-based strategies, that's the blue petal. The evaluation, the orange petal, is built into the process and directly linked to the needs assessment. Finally, we are continually building community capacity and thinking about sustainability and cultural competence through each step of our logic chain. It maps out perfectly. Don't you love it when a plan comes together? Thank you for sharing part of your day with Ohio SPF PFS evaluation team. For more information, please visit the SPF PFS website at pfs.ohio.gov.